Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about endometriosis. We're going to be talking about it from a functional medicine root cause perspective, what you can do to get to the bottom of it, and we'll compare and contrast how conventional medicine would typically handle endometriosis. Before we dive in, please make sure you subscribe to get more great videos coming your way and love to see your comments down below. All right, so let's dive in. Made a little Word document to kind of keep me straight on all the issues that we're going to cover today here. So first things first, what is endometriosis? What is it? We're going to talk about what it is. We're going to talk about some of the underlying mechanisms of it as well, so we can get to the root cause. We'll talk about conventional and medical treatments. We're going to dive into dietary adjustments and then also supplements as well to get to the root underlying issue. All right, so first off, what is endometriosis? So it's a complex condition resembling where tissue so you have the uterine lining. So if your uterus, that's where the baby grows, to the egg implants, and we have tissue in that uterine lining. When that tissue starts to grow in other places in the body, it could be on top of the uterus, it could be on the bladder, it could be on the colon. When it grows in other areas outside of the uterine lining, that's considered endometriosis. They call it stroma, where it's like essentially the cells and the blood tissue, it grows somewhere else, the endometrial stroma. So let me give you a picture of what that looks like here so you guys can visualize that better. So here is the uterine lining here. This would be a normal area for this tissue to be. When it starts to grow outside of it, let's say on the outside of the uterus, or let's say cysts start to form here on the ovary, that's called a chocolate cyst, which is known as endometriosis. Or let's say the bladder, which is right nearby, or up and to the right or left, you're going to have the colon. All these areas are sites where endometrial tissue can easily grow. I'll give you a couple other pictures here so you guys can make sense of it. So you can see here, and again, it creates inflammation, right? So inflammation signaling is happening here, different prostaglandins. So when this is on other parts of the ovarian tissue, uterine tissue, it's not good. It's creating inflammation, right? So if we look at some of the big hallmarks of endometriosis, another one right here so you can see. So you can see these little spots right here are the endometrial growth so you guys can see. But in general, when we look at this, we are essentially seeing the big hallmarks of endometriosis are going to be pain, especially right during your period, premenstrual time and into your period. So difficult pain, pain on menstruation, and that pain can easily be connected to your your bladder, so urination, and defecation using your bowels, because that endometriosis, that tissue is going to be more active premenstrually, right before your period, and also menstrually while you're menstruating. So that tissue, when you're going to the bathroom, could be more painful. Urinating can be more painful. Obviously, intercourse-wise too. And then just during your periods, those cramps and pain. So pain is going to be the big one. And again, the hallmark will be, how do we know if someone has a gut issue versus endometriosis? Well, typically it's going to happen right at around that premenstrual time frame. That would be the big differentiator of how that would express itself. And so that's kind of what the underlying issue is on that front. Let me just kind of go back to my checklist here. We'll make sure we hit that up. Okay, so we talked about the endometrial lining and what's happening there. Now, what's the underlying mechanism? Because it's really interesting. When you understand the root physiology of what's happening, then it's like, okay, why are we making this change? Why are we taking these supplements? What's conventional medicine doing? Does it get to the root cause? Is it controlling symptoms? And so when you get that, then you're able to look at things a lot differently. So first off, endometriosis has a hallmark of estrogen dominance, right? So estrogen dominance is essentially you have your relationships of estrogen to progesterone throughout the monthly cycle, all right? And so typically if here's your monthly cycle, the first half of your cycle is called the follicular phase. So from day 1 when you bleed to day 14 or so, 15 or so when you ovulate, that's where estrogen predominates. Estrogen spikes up around day 10 to 12, and it's at its peak around day 13, and then progesterone comes right up after that, 13 to 15. That's where you ovulate. So that follicular phase is where estrogen predominates. And so when you start to have more estrogen or fluctuations of estrogen, that's a hallmark environment for endometriosis to form. Also, in the second half of your cycle, so your first half is your follicular phase, F for first half, follicular. Second half of your cycle is the luteal phase, or the last half. So luteal, L for last, follicular for first. So that's where progesterone predominates. So our progesterone comes up like this. and it's going to peak around day 20, and it's going to come down after that. And typically it comes down right around day 27, 28, and that drop in progesterone and estrogen triggers actually that menstrual flow. And so with estrogen dominance, it's a combination of higher estrogen, but it also can be lower progesterone. So if here's progesterone normally is 20 times higher, 22, 23 times higher than progesterone overall throughout the cycle. And so if that relationship starts to drop on the progesterone side, even if estrogen didn't go down or didn't go up, that's still estrogen dominance. And so keep that in mind. It's not just estrogen being up, it's also progesterone being lower. And it's not just the levels too, it's the aberrations in estrogen as well. Because when we look at how conventional medicine addresses a lot of this stuff, what does it do? It gives birth control pills, which most of the times are going to have synthetic estrogen. It's usually going to have synthetic, like a ethinyl estradiol, which is a synthetic estrogen. Sometimes they'll use a birth control pill in there, like a norestrogel, which is a synthetic progestin as well. Again, these are usually synthetic type of horse progesterones or synthetic man-made progesterones, not like natural bioidentical progesterone. But what they do with these is they're taking them, that's taking the FSH and the LH signaling in the brain. That's the feedback loop in the brain. And it's essentially knocking that feedback loop down. And so when that feedback loop is down, it's not yelling to the ovaries to make more hormones. And so when the FSH and LH is down, you're going to get less hormonal signaling to the ovaries with progesterone and estrogen. And so it starts to regulate and lower the hormone levels. And so part of why birth control pills may work in the short run is you're getting the levels more stable, you're decreasing the FSH, so then you're getting a more smooth curve throughout the cycle. The problem is you are adding in synthetic hormone. And in the long run, so there's studies on this. I'll pull up one study here in a minute. But when you look at some of the studies on this, it shows that, yes, birth control pills and these synthetic hormones could potentially help in the short run. The problem is, in the long run, once you're off of it, you're at higher risk. So here's one study here. The risk of endometriosis appears reduced during OC, so that's oral contraceptives. However, it's not possible to exclude the possibility that the apparent protective effect of OCs against endometriosis is a result of postponement of surgical evaluation, confounding by the section. So there's one part in here. Where is it here? There's one part in here in the actual conclusion, and I pulled it right here, where it talks about the fact that, all right, here it is, the next sentence here. Confounding by the selection and indication biases may explain the trend towards an increase in risk of endometriosis observed after discontinuation. So that means, hey, these women are taking birth control pills, they get their endometriosis symptoms better, they come off the birth control pills, maybe they want to get pregnant, maybe they're having side effects, either way, they're off the pill. Now the risk actually goes up higher for endometriosis. You didn't actually fix the underlying physiology. You may just be delaying it, and you're further adding fuel to the fire because the endometriosal risk factor of estrogen dominance is still there in the background. That's why it says here there's this increased risk towards endometriosis observed after discontinuation. So keep that in the back of your mind when we look at the various risk factors that are happening here. Okay, so in general, those are big ones. Inflammatory prostaglandins are a big one too. So inflammation and lots of things impact this. We'll show you a whole study on probiotics actually being very beneficial. They're looking at probiotics and they can actually predict endometriosis risk with low levels of lactobacillus in the vaginal area and the microbiome area. Isn't that fascinating? So low levels of probiotics have an influence on these prostaglandins, which are going to, like usually it's prostaglandin 1 and 3. Certain fatty acids can play a big role. That's why having healthy fats, having healthy, good grass-fed meat and good healthy fats from omega-3s and good, maybe healthy GLA fats with certain women like with black currant seed oil or evening primrose oil can also be helpful because it modulates these prostaglandins. So reducing inflammation in your diet is going to be key. Now, birth control pills, I mentioned what it does, right? It's short-term helping, not fixing the underlying issue long-term. Environmental estrogen, so plastics, pesticides, chemicals in these hormones will also be in your conventional foods, right? A lot of the organochlorine pesticides seem to mimic estrogen. They have a estrogen kind of backbone, if you will. And so they're going to potentially worsen the symptoms. Why? Because if we know endometriosis is a estrogen dominant kind of physiology, and if we add more estrogen, more fuel to the fire, of course, we may have more endometrial tissue growth. Let me pull up this study here for you guys to see. See here, I'll pull that one up in just a second here so you guys can see it. It's quite fascinating. Okay, this is looking at this is the one looking at the connection between microbiota and endometriosis. So pretty fascinating here. So it's looking at possible explanations and the implication of dysbiosis, that's bad bacterial overgrowth, and endometriosis, including in the bacterial contamination theory, and how it impacts the activation of cytokines, altered estrogen metabolism. Why? Because let's say when we have bad bacteria, dysbiosis, we make an enzyme called beta-glucuronidase. And this enzyme actually inhibits estrogen metabolism. So when we go to detoxify estrogen, we conjugate it, we bind protein to it so we can excrete it out the body in phase 2 cytochrome P450 oxidase pathways. And when dysbiosis is there, we have this enzyme, beta-glucuronidase is higher, which makes it harder for us to excrete and conjugate these estrogens. Fascinating. And so they're looking at here, I want to make sure I hit this, endometriotic, that's the word I'm looking for, endometriotic microbiotas have been consistently associated with diminished lactobacillus dominance. So that means low levels of lactobacillus, as well as the elevated abundance of bacterial vaginosis related bacteria. Usually that's going to be like your Gardnerella type of bacteria. Possible explanations for the implication of dysbiosis in endometriosis include the bacterial contamination, immune, cytokine, gut, estrogen signaling, and aberrant in stem cell homeostasis. So it's just saying this is the theory we have, right? We don't know for sure, but it makes sense, right? When we understand the gut and how important it is with estrogen detoxification, and we understand how prostaglandins are influenced by beneficial bacteria, that if we see these altered imbalances, these altered hormone detoxification pathways, altered levels of beneficial bacteria, we have high levels of dysbiotic bacteria, it makes sense that this could impact the hormones. All right, let's go back to my big screen here. Okay, so plastics, pesticides, this is another big one. So I got another study here I wanted to show you guys on organochlorines. And again, like, it takes decades for these things to get into mainstream medicine. And when you can't patent diet and lifestyle changes, you're just not going to hear about it by your conventional medical doctor. Your medical doctor is basically educated by big pharma to prescribe drugs and to do surgery. That's it. Now, again, surgery may be warranted with endometriosis. If you've been growing endometrial tissue for many years and decades, it may make sense to engage in some kind of specific laser surgery if you can, because laser is going to allow you to really peel back the tissue in a more, let's say, gentle, superficial way. If it's really big, you may have to come in there with a scalpel and cut that tissue out. So I'm not saying surgery is bad. At some point, surgery and surgical intervention may make sense, but is it getting to the root underlying cause? No. So there's, let's say, early stages, early days where you could come in and maybe reverse this and have some good luck, especially if your pain isn't super bad, or if it's a lot of growth, you may need a surgical intervention. I recommend go more with the laser surgery if you can, because it's going to be more specific and it's not going to be, it'll be more, more gentle, and you have a greater chance of cutting out or avoiding the removal of excess healthy tissue, because the laser, you can be a little bit more specific on that. But looking at this study here at pesticides, this is very cool. So in this study here, they conducted analysis of the women's risk of endometriosis study population, looked at these populations, and our case control study of the women enrolled in this large healthcare system, Pacific Northwest. They were looking at various organochlorine pesticides, extensive past use of environmentally persistent organochlorines. These are the big common pesticides. United States or present use in other countries may affect the health of reproductive age women. And then our data suggests the increased endometriosis risk associated with serum concentrations of beta-hydroxychlorohexane. The association between beta-hydroxychlorohexane concentrations and endometriosis was stronger in analysis restricting cases to those with ovarian endometriosis. So there's a correlation, right? Again, when we look at these things, there's never just one thing. And so when you're like, Dr. J, that's correlation over causation, for sure. But when you have a lot of correlations where there's smoke, there's fire, when you understand the root underlying physiology mechanisms, extra estrogen, estrogen dominance, anything that could add estrogen into the system could be a root underlying cause. So our big estrogen drivers are going to be organochlorines, our pesticides. Most of our pesticides are going to have an estrogen backbone. Guess what? Estrogen in the plastics. You could add in estrogen to the soy, maybe the parabens and the estrogens in our makeup or skincare products. And then if we have dysbiotic bacteria, low levels of lactobacillus, the increase in beta-glucuronidase, low progesterone, chronic birth control use, right? Many years. These things could all add in, let's say, fill up our estrogen bucket and increase our chance of endometriosis. So very important there out of the gates. So let me kind of go back here to my Word document here to make sense of that for you guys. All right, so we talked about the pesticides. Talked about the mimicking the estrogens. All good stuff out of the gates. The microbiome, the dysbiosis, the low levels of probiotics. Birth control pills, they do work in the short run. What do? They could actually add estrogen into the equation, right? So, but what it does is it's going to prevent the fluctuations from happening, and it's also going to decrease a lot of the prostaglandins and the inflammation. And guess what? When you're taking estrogen, you're decreasing LH and FSH. You're not ovulating. And when you're not ovulating, you make a lot more prostaglandins when you ovulate. So if your hormones are off, but you're ovulating, you're making a lot more prostaglandins, which could fuel the endometriosis. So by not ovulating, you're also decreasing the prostaglandins, which are a fuel for the endometrial tissue growth. All right, so conventional treatments, how are they handling it? NSAIDs, pain relievers, right? Motrin, right? So you get to period time, Midol, right? Which is basically a pain reliever and caffeine. You get to that period, premenstrual period, that 7 days before, pain meds, maybe pain meds during your period. Other hormonal therapies. So we have our birth control pills. Some may do an estrogen, just dominant BCP, birth control pill, or some may add a synthetic progesterone, like a levonorgestrel, which you see like in a Mirena IUD, for instance. Then we have our GnRH agonists, right? These are the things that shut down the HPA or the HPG axis, hypothalamic pituitary gonadal axis. This is going to be our Lupron, right? This is common that you're going to see with IVF as well. They do have to totally shut down the woman's cycle, and then they kind of reprogram it with the medications. And they're shutting it down. Of course, that decreases estrogen because you're basically nuking FSH, right? But it's not good for good hormonal health in the long run. And then our progesterones, which is going to be our levonorgestrel, the medroxyprogesterone. And then, of course, in severe cases, laparoscopic surgery. That's what they're going with the scopes. They're not going to open you up per se, but going with scopes. And they either can laser it or they can cut the tissue out. So again, lasering will allow more specificity, but if you have lots of tissue, they're going to want to cut and then maybe laser everything down after that. And again, here's the big study. Here was the big kind of article there. Current use of oral contraceptives may decrease the risk of endometriosis. Previous users might not see an increased risk, and evidence is insufficient to recommend them for sole prevention, meaning you were on it, you're now off. Now you may actually have an increased risk factor because you were on it and now off. But most women, they're not going to be on birth control pills their whole life anyway. So then what are we doing here? We're just robbing Peter to pay Paul, if you will. Now, diet-wise. So we want to make sure the foods that we put into our diet are going to help with estrogen metabolism. That makes sense, right? We want good, healthy cruciferous foods that are going to have diindol methane, indole-3 carbinol. Healthy gut bacteria makes that conversion of indole-3 to diindol methane, by the way, which helps with metabolizing estrogen. We want healthy gut bacteria, so getting good, healthy fermented foods in our diet. Sauerkraut, maybe some low-sugar kombucha, some kimchi, some fermented pickles. If we can get good, healthy probiotics in, and maybe even adding probiotics if your diet doesn't have those foods in there, can be very helpful. We want to make sure we're eating organic. We don't want the pesticides. We don't want things like glyphosate, which is originally registered as an antibiotic. So we know that if it's an antibiotic, it could probably impact our good bacteria in our gut. Remember the study I showed you, right? Lactobacillus was almost a predicting factor, or is a corollary factor of endometriosis. So if we're lowering lactobacillus because we're getting exposed to glyphosate / Roundup, that's not good. Or the organochlorine pesticides that I mentioned in the organochlorine study, which are like the predominant pesticides out there. So we want to decrease exposure to our pesticides as well. So eating organic, having good healthy proteins and fat. Now, when we talk about endometriosis, There's a couple other conditions women confuse it with. So we have uterine fibroids, which are going to be like, it's a leiomyoma. It's a benign tumor that grows in the uterus, in the muscle, or on the outside. The difference is that's more of a tumor, right? Where endometriosis is actual endometrial tissue. That's the difference. Both are actually driven by estrogen dominance, by the way. So similar mechanism. Again, usually with fibroids, you got more heavy bleeding and lower iron, those kind of things, but still similar mechanism. So we could confuse fibroids with endometriosis, right? One's a benign tumor, one's endometrial tissue outside the body, and then fibroids can grow outside of the body too. And then the last one typically is going to be polycystic ovarian syndrome. That's PCOS. So now we have ovarian cyst, and ovarian cysts are primarily driven by excess insulin. And then the hallmark of excess insulin, we have excess androgens. So insulin and androgens driving these ovarian cysts. PCOS means many, right? Many ovarian cysts. Probably the number one cause of infertility in females is going to be PCOS. And so we treat that with the major drug in that is going to be what? Metformin glucophage. So that's an insulin sensitizing agent. So blood sugar and insulin plays a big role. So when I go back to my dietary recommendations, what diet do we recommend? Whole foods, anti-inflammatory, organic diet ideally. Balance your blood sugar, healthy protein, healthy fat at every meal, because we don't want these up and down swings of blood sugar, because guess what? You could have endometriosis and PCOS at the same time. We don't want to be making blood sugar swings because that could cause our prostaglandins to also go up, our inflammation to go up. So we want to focus on nutrient density, bringing systemic inflammation down, and we want the nutrients that are going to help with estrogen metabolism, and we want to bring healthy bacteria levels, probiotics into the gut, and we want to, let's say, not feed the bad bugs. And so the processed flour, the processed grains, the processed sugar, the glyphosate, and the pesticides are going to really screw up our microbiome. Now, supplements. What are we recommending with supplements? So great questions here out of the gate. And I have a couple recommendations here. So one of the big ones, omega-3s, good healthy fatty acids, work on modulating our prostaglandins. We may recommend cod liver oil. We may recommend omega-3, eating healthy wild Alaskan sockeye salmon or good frozen, let's say wild salmon, if you will. Avoid the farm fish due to the antibiotics and potentially chemicals in the water. Next, a black currant seed oil can help modulate some of the prostaglandins. That's a GLA fatty acid. Very good too. We may also use things like curcumin that are anti-inflammatory, help with pains. We may use things like curcumin, boswellia, and frankincense to manage pain. We may use things like ginger as well to help manage the pain as well. We may use things like chaste tree and maca to work on modulating some of the hormones. Again, I recommend when you're starting to get into hormonal territory, you really want to be working with a functional medicine doctor to get your hormones looked at, see what's going on with your hormones, look at what's going on with your gut as well. Really important out of the gate. NAC is very helpful, right? It can disrupt endometrial tissue growth. So I like N-acetylcysteine. Curcumin, anti-inflammatory, antioxidant. Resveratrol inhibits proliferation of endometrial tissue. Again, resveratrol, it's an antioxidant you'll get in some of the wines, some of the berries. Don't try to get it from wine and be like, oh, I'm getting my resveratrol. You're not going to get enough, right? So resveratrol is powerful as well. There's pterostilbene, which is a resveratrol cousin, if you will. DIM or diindol methane or indol 3-carbinol. This is what we're going to get in some of our green leafy greens, our broccoli sprouts, our Brussels sprouts, our cruciferous. Again, if you have poor digestion, cook and steam those to decrease the goitrogen so you're not impacting your thyroid. But very good for detoxifying estrogen. We may add in things like glutathione. We may add in things like Vitex or chaste tree or progesterone. So again, you don't want to be guessing. You want to be testing. You want to be assessing, right? Assess, not guess. So that way you know what's going on. Again, I always look at it and say, what's the underlying issue? Does the conventional medical approach make sense? It makes sense in the short run. Here's an ibuprofen. Here is a birth control pill, maybe because I'm in tons of pain. But let's fix the hormones. Let's not throw more estrogen in, which we know is actually potentially fuel for later down the road when you come off. Let's actually get the hormones more stable. Let's prevent the fluctuation. Let's work on progesterone levels. Let's work on the estrogen dominance. Let's work on the gut. So I just wanted to get everyone to think about this a little bit deeper so you understand how conventional medicine looks at it, how functional medicine looks at it, and kind of where we would sit in the middle and how we would handle it and how we'd approach it. I hope that makes sense. If you have any questions, you want to dive in deeper, my link will be down below. If you want to reach out to my staff and team, we see patients worldwide. If you want to dive in on the functional medicine side, we order these labs for patients all over the world so we can look under the hood and see what's going on and what kind of a plan we can make specifically for your imbalances. But I always recommend start with the common sense, low-hanging fruit, diet, lifestyle. Get the excess estrogens in the environment out of your environment. So the plastics, the pesticides, eat organic, good healthy proteins and fats, and work on getting your hormones looked at and dialed in, get your gut dialed in. So if you want to reach out, down below, there'll be a link. Any questions, let me know. I'd love to see it in the comments, guys. All right, have an awesome day. Take care, y'all. Bye.